What should you do if you are injured during class, performance, rehearsal? In this video, I'm going to talk about the immediate steps to take if you've had an injury. And the areas I'm focusing on will be the areas that dancers get injured most with, and that is the foot and ankle, secondly, knee and hip. So in this video, I'm going to show immediate steps to take. And usually when a dancer gets injured, I've seen many teachers just have them go to the front of the room, sit and watch, and then just wait for their parents to come. We can do better. And if you have a few things in your dance bag, you will be better prepared to manage injuries if and when they happen. The studio should also have a cold pack on hand of some kind. Some of them don't even have to maintain a temperature in a freezer. They can be just ones that you slam on the floor and then it immediately activates a chemical reaction to make them cold. There are some sporting goods stores that sell these. So anyone that has a studio, these would be really good things to have on hand for your students in case one of them gets injured. So here are my takeaways on what to do other than just sitting and watching class if you get injured. So here's an example of an ankle or foot injury. The first thing that you want to do is see if you can put weight on that foot. You want to try to put it down flat and see if you can walk. If you cannot put weight on it, you need to go to the emergency room. If you can put a little weight on it, the next step is to have a seat and to inspect the joint. And you want to inspect the skin next. So you need to take off your shoe and your tights to look for any discoloration of the skin and also any swelling. And you want to see how black and blue it is and how swollen it's getting. So inspect the skin first, and then you want to move the part that hurts. Wiggle your toes, make sure you can move your ankle, touch the skin, and make sure your sensation is intact. Then after you've assessed all that, you apply compression. And the easiest thing to use is a leg warmer that's snug fitting or a sock, an athletic sock that comes up over your ankle, a knee high. All those things are good to have in your dance bag. So then you need to get ready to go home. You're not just going to sit there and watch class. You need to keep your body warm. So a pair of sweats is good to have in your dance bag. So you can put on your sweats to get ready to go into the air outside. So you want to keep the whole area warm because your body's going to be warm after taking ballet class and you don't want your temperature dropping too quick. And then you must have sneakers in your dance bag so that if you get injured, you're not stuck with flip-flops that are going to be very dangerous to wear after injury. So if your studio does have a cold pack, the proper way to apply it is directly against the skin, but not with a towel. The towel is not going to allow your skin to get cold enough for the benefits of the cold pack to act as an anti-inflammatory. You may put the cold pack over your tights to reduce the risk of freezer burn. And then an easy thing to use is a dance bag to elevate. So you also want to elevate your foot and ankle after it's been injured. And you can put that dance bag a little bit underneath your knee as well and leave on the cold compress for 15 to 20 minutes. Make sure that cold pack conforms to your body really well so that the area gets nice and cold, and then you can put your sweats on and sneakers and be ready to go. If you are fair-skinned, you need another layer. So a pillowcase is a good thing to use, not a towel. So you can just slip the cold pack in the pillowcase because if you're fair-skinned, you're going to be more susceptible to freezer burn. So your redheads out there, fair-skinned people, this would be a good way to apply the cold pack. The same steps apply for a knee injury. The first thing you want to do is inspect the skin for bruising and swelling. Next, you're going to bend the knee up and down, and you're going to see if you have full range of motion. And you're also going to listen and feel for any clicking or popping in the joint. Clicking, popping, and sharp pain can be signs of a more serious injury, so you'd need to see a doctor. Then you can apply a compression with a leg warmer. At this point, if there is a cold pack in the house, you apply the cold pack before putting on the leg warmer. If it's a hip injury, same steps apply, but you want a leg warmer that covers the hips. And then after you apply compression, you can put on your sweatpants and sneakers and be ready to go home. Lastly, you want to be sure you hydrate as soon as possible. Maybe while you're using that cold pack is a good time. Have water in your dance bag ready to go. The water will help reduce the inflammation and help your body heal. Main takeaways of this video are to inspect the area that you injured. You're going to be looking for color, discoloration. Is it yellow? Is it bruised at all? If it is bruised, black and blue, how badly is it bruised? If it's bruised badly, which means like a dark purple or black, I would say go see a doctor as quickly as possible. If you have swelling, that's the other thing you're looking for. If it swells up like a balloon, okay, twice the size of the joint, like go see a doctor immediately. You want to go to the emergency room and get it checked out. Those are signs of more serious injury. The more discoloration, the more swelling, the more serious. And so definitely get that checked out immediately. If the discoloration is minimal, maybe it's just a little yellow, maybe just a little bit purplish, but not bad, and there's just a little bit of swelling, treat it for a day, rest, ice, elevation, compression. So RICE is the acronym to remember for that. Those are the things that you want to do to reduce the inflammation. So I talked about each of these things. Resting is just getting off of that limb, whichever leg that you injured, you want to get off of it. And then as soon as you get home, you're propping it up with pillows. Ice, you want to put a cold pack to the area. You don't want to put a towel between you and the cold pack. It's not going to get cold enough. You can put a pillowcase, but nothing more. Leave it on for about 15 minutes at a time till it's pink and cold to the touch and numb. That will help reduce swelling and inflammation most effectively. So we have rest, ice, compression. That's the sock. That's an easy thing, an athletic sock to provide compression. That could be both to the foot and the ankle if you injure those sites. A leg warmer, a full length leg warmer would be great. That could get the knee joint, and if they're full length leg warmers, that can get the hip joint as well to give a little compression to the joint, which will also help reduce swelling and inflammation. And elevation. When you're lying on your back, you want to elevate the limb that's injured above the level of your heart. So if you're laying flat, the whole leg should be slightly higher than your chest to help the most with decreasing any swelling. If the next day your pain is increased, the swelling is increased, go see a doctor immediately and get it checked out. These steps are very simple to take. They're PT 101, so I hope this will help in case injuries happen to you.